I know the work is mostly India, Brazil, South Africa. Have any of these governments? How would you assess their performance around kind of procuring, manufacturing COVID vaccine? Like how should we judge them? People are sort of using words like disaster. I mean, I see a couple of comments you may have seen them on the screen with regards to South Africa. So I'm curious to know from you, like of these different countries, like who do you think has actually done better? I know that we have Gavi, the COVAX, this sort of broader context. But where do you see these countries like South Africa, Brazil, India fit in this story?
Yeah, so this is really interesting. I'm raising my voice a little bit because I think there's a complaint that my voice is too soft. I don't know what it is. I'm using a new set of headphones. But so if I'm screaming, then please adjust your volume. India and South Africa have been pretty good. They made a proposal at WTO to have the WTO suspend intellectual property monopolies in this pandemic. That is still being discussed. Brazil, under Bolsonaro, surprisingly, has been really bad. And what Brazil did is unconscionable because it joined a handful of rich countries, literally about 8 rich countries, in opposing the proposal that India and South Africa floated at the WTO. Meanwhile, last week, the president, Jair Bolsonaro, wrote to the Prime Minister of India, our own fascist, to say that he needed an emergency shipment of a couple of million vaccines because their supplies of vaccines haven't kicked in as yet. What is happening in Brazil, I think, is by far the most egregious situation possible. They've delayed vaccine rollouts as long as they could. They've resisted vaccines. The president has been incredibly harmful in terms of what he said about vaccines. There's a battle between the state of São Paulo and the federal administration based in Brasilia. So the São Paulo has rolled out Sinovac, a private Chinese corporation which created a vaccine called CoronaVac just yesterday. Meanwhile, the center is trying to airlift vaccines from India. Some of their own smaller states in the north and the northwest have made their own deals with Russia. It's an unbelievable mess in which infection rates are skyrocketing, in which deaths are skyrocketing. And it's by far the country that's handled this the worst. And I think that therefore really needs to be called out. India and South Africa, I think, have been a bit feckless, aside from this one inspired proposal at the WTO, which was really the work of one South African, Mustaqim Degama, who is the trade representative at the South African mission to the WTO. India just sort of tagged on this exercise. I think there's a curious situation happening, which is that of all of the Western vaccines that exist, you have about 9 vaccine candidates, and only 2 have thought about global access in any serious way. Only one of those vaccines has actually been approved, and that's the AstraZeneca vaccine. They've given out a contract to the Serum Institute, a large volume vaccine manufacturer in India, to produce 1 billion vaccines of the AstraZeneca candidate in 2021 and another billion in 2022. These vaccines are for all low and low middle income countries, including South Africa, except the government of India is now going to decide who gets those vaccines among those many, many countries. And this is a really interesting situation because you have something that should be equitably distributed among all these countries. You could argue that they should all get the same percentage, including India. That's not going to happen. We're going to get a greater percentage because the government can take it. But at the same time, there's something almost perversely opposite that's happening in South Africa, which is that Johnson & Johnson, which has a candidate that is expected to go into approval next week. It's very, very close to being approved. They have an outsourced manufacturing contract with Aspen, which is a South African generic company, and they're making 300 million doses of this vaccine in South Africa. How many of those doses do you think will go to South Africa? Guess? 0, because Aspen will have, as per its contract with Johnson & Johnson, will have to ship those vaccines to Johnson & Johnson to distribute. So this is a really perverse situation, right? Where you have one country which is possibly meddling too much and is probably going to take a much larger share of the pie than it deserves. And then you have this other country meddling too little, not going to take, possibly at the moment, the share of vaccines it deserves.